Do you want a more voluptuous booty without surgery? It is possible. We are coming to you live from Contour Medical in Gilbert, and in a matter of moments you are going to see a live butt lift procedure that is giving patients results in minutes. This is the before and after pictures, and we are here with Dr. J.D. McCoy. He's the founder and medical director here at Contour Medical. So what is this treatment called?
We're calling it C-Sculpt because we're using Sculptra to sculpt the butt. And basically there's been this craze of people wanting a more voluptuous, more round buttock, AKA the Kardashians.
I was waiting on it. So we want to show some before and afters, because what's really cool about this procedure, it's instant, right? So they're going to get results rather quickly. And when they come to see you, do they decide if they want a round booty, if they want, what type of booty you're going to sculpt?
You know what, the funny thing is, a lot of people might come in wanting a certain shape to their buttock, but for the most part, this is really a restoration project, meaning we're restoring the more youthful shape. We can do some augmentation, meaning some creation.
Right.
But most of it is corrective, meaning as we age, the buttock loses support, it becomes more square, more flat, more A-shaped. There's the different characteristics, and what we want typically is a more round and a more lifted, more lift and more of an athletic look. And a big reason for this is we just have to look around nowadays.
Right.
Everyone's wearing yoga pants. They're wearing it for a reason because it shows off the booty, whether we want to or not.
Or not, that's right. So you have a beautiful patient here.
Yes.
Her bum looks fine to me, but I can understand. What are you going to fix? What does she want fixed?
What we're going to do is when you lose volume as you age, even someone that's working those glutes hard in the gym, we lose most of the superficial fat from the buttock. So the way that we're going to lift the butt is focus on correcting some of that volume loss in the superior portion. And we can do a little bit of shaping. I drew on the patient with her in a standing position so that I could see where the defects are, where we have a little bit more of an indentation. Because some women, especially if they're athletic, they'll get kind of almost a masculinization of the butt, meaning they get an indentation to the side, which they don't really like. They want more of a feminine looking round buttock, and that's what we're going to try to achieve with this. The thing that's cool is this is truly something that's restoring the tissue. Sculptra is a natural product. It's polylactic acid. It stimulates collagen. It stimulates the growth of tissue. So not only will we get some volume, but the skin will start to look better too.
I want to let you get started because I know she's already had numbing. What is she?
We just do a little topical numbing.
Okay.
There is numbing in the Sculptra, so it kind of numbs as it goes. It's not what I would describe as a painful procedure at all. It feels weird. Okay, a weird sensation. There'll be minimal post-treatment swelling, minimal bruising. But all of it's pretty self-limited.
All right, so this is the amount of Sculptra that you're using.
Yeah, we're going to inject 10 vials today.
Okay.
On average, most patients, I'm going to be doing an average of about 20 vials with them. We can go up to the Brazilian C-Sculpt, which is 30 plus vials. So we're kind of, you're in the driver's seat as far as what we're trying to achieve.
I love that. And speaking of Brazilian, we got a question. We want to solicit questions from you. If you've got a question for Dr. McCoy, he's going to be performing this procedure in just a few minutes. We encourage you to ask them because he will answer your questions in real time. And we already have a question. Julia says, oh my gosh, I need this. I'm Brazilian. So she wants that nice, round, curvaceous behind. Because you can spend a lot of time in the gym. You can do a lot of things. But sometimes Mother Nature just takes over and gravity.
Right. And there's a reason why we're gravitating towards Sculptra. It's very important because the gold standard right now is doing fat transfer or gluteal implants. Okay, so we do an implant. The problem is there's high complication rates.
Well, I was going to ask you, when you talk about, like you said, there's enough reality television out there, and many of you may have seen some botched booties. Does this procedure correct?
Yeah, this can be used for correction.
Okay.
So if someone has a contour defect from a previous procedure, and more importantly, if someone doesn't have a lot of extra fat, then this is a procedure that can be used because we don't have enough fat to transfer. So what ends up happening is a lot of the patients that want more volume to their buttock and would be typically using fat are not good candidates because they don't have enough fat to do it. Sculptra, that's where that comes in. For those patients that want volume but don't have a lot of fat to transfer.
Okay.
Okay, so we're going to get started here.
All right.
You're going to feel a little pinch,
And so she does have a numbing cream on right now. For those of you who are just joining us, we're coming to you live from Contour Medical in Gilbert. You are watching a live procedure of what's called a C-sculpt here. It's a butt lift of sorts, but you're using Sculptra.
Correct.
And Sculptra, for those who don't know, you said it's more natural. It's a more natural type of injection?
Yeah, it's polylactic acid. So traditionally we've used it since the early 2000s for lipoatrophy and HIV, so for facial wasting. And I'm a top 100 injector of Sculptra in facial application. So that little bowl behind you shows the last few months of injections here. So I do inject a lot of Sculptra.
Yeah, and when you hear that mentioned that you are a top 100 Sculptra injector in the nation.
In the nation.
If I'm watching this, what does that mean for me as a client who's going to come see you? What kind of training is that? What kind of experience is that? Why would I want to come to Dr. McCoy?
So the big thing there is a lot of it has to do with experience. So what I can say is the physicians that are top 100 are typically among the most experienced with the product, and they're injecting a lot of volume on a regular basis. So like anything, the more you do of it, the better that you'll get. Mm-hmm. So it's one of those things that, because I'm doing it every day, multiple times a day, like I'd say on average I inject probably between 5 and 10 people a day.
Wow, so 5 to 10 people a day you're injecting. So what's happening right now? Tell us what we're seeing.
Right now what I'm doing is I'm placing the Sculptra in the deep fat, so I'm above the muscle. And what's going to happen is the Sculptra is going to start to stimulate collagen. And the issue is we need enough Sculptra so that we can get a really nice, robust collagen response. And so it's really a numbers game, meaning we just have to inject enough product in the right place.
And so what is, and her name, what is her name?
Or are we allowed
to? Oh, that's okay. That's all right. Well,
okay to say it? That's fine. Yeah, we'll say Casey.
Okay, Casey. What are Casey's goals here? What are you going to give? What kind of bottom will Casey have after this procedure?
Well, we'll get a little lift. We'll get a little bit more of a rounded shape, and the thing that's really nice with this procedure compared to other types of procedure for the buttock, she's going to have really no downtime, meaning she'll have a little bit of soreness, but for the most part it's going to be pretty self-limiting.
What about the results? How long will they last?
How long will the result? Many years.
Oh, okay, so years.
Yeah, we're thinking, so there's not as many, I need you to hold that for me. There's not as many really long-term procedures that have been done with this, meaning it's not like this is something that's been done for like the last 10 years. So we're estimating based on the volumes that are used, you're going to get, probably 3 to 5 years plus out of this.
Wow, okay.
Yeah.
And
the on-label indication for Sculptra is for 25 months.
Okay, and let's talk about the quality of the skin after a procedure like this. Mm-hmm. It's going to continue working as far as collagen reproduction?
Yes, it will. Basically, it continues to stimulate collagen in the studies up to past 12 months. So we're going to get 12 months of collagen stimulation, meaning it's going to improve for 12 months. But I've seen patients beyond 12 months that actually seem to still have correction.
Yeah.
The thing is, what's happening with this is initially you get collagen that forms, but then what actually happens at the 6-week mark is you get new blood supply to the tissue. And that new blood supply makes the skin and tissue look better.
Is she feeling anything? Is Casey having any
discomfort? Are you having much discomfort?
It doesn't feel uncomfortable at all.
Oh, okay. She said it doesn't feel uncomfortable at all, and you couldn't hear her very well. But she said it has no discomfort, and you said no downtime either.
Yeah, because most procedures for the buttock, you actually you can't sit on the buttock.
I was about to say you got to stay on your feet.
For weeks. So part of this is, you know, most patients don't want lots of downtime, and especially if you're not a sleeper on your belly or on your side, you can't sleep on your back after you do
so
traditional.
She'll be able to go,
with this, there's no restriction. Yeah,
all right.
No restriction at all.
And what I like about some of the before and afters that we were just seeing, you don't have to wait for this. As soon as you're done, as soon as Casey gets up off the table today, she's going to have a better looking.
She is, but what I do have to prep the patient for, because Sculptra takes a little time to see the full result. Initially, we're going to see some swelling.
Okay.
The swelling will come down.
And how long will the swelling last?
Usually a few days.
Okay.
So they really like it for a few days. And then as the swelling comes down, what will happen is over the next few weeks, next few months, it just keeps getting better and better and better.
Yeah, and Casey, your derriere, like I said at the beginning, it already looks amazing. Are you excited about this treatment?
Beyond excited.
Oh, she's beyond excited, she says. What were some things, I know Dr. McCoy kind of talked about some things that he's going to address. Did you have any issues when you looked in the mirror and saw your backside?
Yeah, I'm 44, so I definitely saw.
Hey, we're the same age, Mama. All right, I get it. I'm ready to get up there too. So when you looked in the mirror, you felt it sagging a little?
Yes, definitely.
Yeah, and you wanted, you know, those tight jeans.
We all want to be back to our youth, don't we?
Absolutely, absolutely. So what are you hoping to achieve with this?
I'm hoping to restore, you know, kind of what it used to look like.
Yeah, back when we were in our
Exactly.
20s, we didn't have to work so hard at it. Will she have any, you said that the discomfort this evening is just the swelling, right?
Correct.
Okay, so there'll just be a little bit of that, and that'll go away in a couple of days.
Correct.
Does she need to do anything special as far as, you know, what she needs?
We have a protocol that we use, so we're going to do a very special massage protocol. I want you to roll away from me just a tiny bit. There we go.
Yeah, so I was just reading a question. I'm up here so busy chatting with Julia wanted to know how many days until the final results.
Final results, believe
Thank
it or
you for
not,
your question,
that is
Julia.
a good question. Final result, I would say you really want to give this a good 3 to 6 months to see a final result.
So 3 to
And
6.
you'll get some skin quality improvement beyond that, but really you want to give it a good 3 to 6 months.
Okay, so 3 to 6 months for the full effect. But it'll last for years, and then that's the great part about it. I also want to talk a little bit, Dr. McCoy, about, we talked about you being one of the top 10, 100 Sculptra injectors, but I also want to talk about some of the trends that are happening that you're seeing in cosmetic surgery right now.
Yeah.
What are you seeing?
Okay, so right now, this is obviously one of the big trends. But what I would say the biggest trend is more this kind of concept of regenerative medicine, meaning using our body's own healing capacity, own growth factors, own fat, own blood, all these different things to restore the tissue, to rejuvenate, whether it's the hair, whether it's the sexual organs, whether it's erectile dysfunction or vaginal function in women. All of these things are really exciting, and it's all really focused on regenerative medicine. So for example, one of the hottest things I think we'll see over the next little while is hair regeneration.
Yes.
Using your own blood.
And you'll be offering that here?
Correct. Yeah.
Okay.
I've actually been doing that for many years, but I really wanted a little more science out there to predict the outcomes and really kind of fine-tune as far as from a safety standpoint. And I feel very comfortable now that that we're there as far as some protocols based on what other doctors are doing throughout the country with me.
Perfect. And for those of you just joining us, you are watching a C-Sculpt here at Contour Medical using Sculptra. It's a butt lift. It's going to improve the shape. It's going to be a subtle lift, no downtime, very minimal bruising. And Dr. McCoy is doing this procedure on a mid-40s, a woman in her mid-40s, who wants to just get that lift back, wants to get her booty back, and don't we all? Reality television is unfortunately kind of dictating what we do these days.
This is true.
But the before and afters, and it's interesting because we all have a different shape behind, from an A shape to a V to square to round, and you really do try to keep it with our natural shape of our behind,
yeah,
right?
so most people have a natural shape, and what we want to do is typically gear towards more of a rounder shape.
Okay.
But especially when we kind of become deflated as we age, if we can just restore a more youthful look to the buttock, then that's a positive. That's
so this is the before and after here on the screen, and it's about 6 months before you will see full results, right, of the entire treatment. But she's going to see some results right away, and then it'll gradually get better as we go along. We do want to encourage you to ask questions. If you do have questions for Dr. McCoy, he does a number of procedures. We're focusing on the butt lift today, but he does a number of procedures here at Contour Medical. If you've got questions, please, we ask you to submit them, and he's going to answer them for you in real time. But we are doing the treatment as we speak. And how long does the entire treatment take?
The treatment takes about 20 minutes.
Okay, so not too long.
Yeah, we're almost
20 minutes.
done. We're almost done.
So you're on the other side. We were on the right side.
Yeah,
so you're
we're
completely
done.
finished
We're
with the
done on
right.
this side. Yeah.
So the right cheek is done. Now we're doing the left cheek. And she had some numbing cream, so she's not feeling any discomfort. She said it feels great. She's excited about the results. We're certainly excited with her. But I want to show you the before and afters as they rotate through so that you can see exactly what it's going to look like in about 6 months. But we appreciate all of your questions that you're submitting to us so far. But keep them coming. We want to keep them coming. Dr. McCoy, when you talk about the latest and the trends that are out there, this obviously there's a lot of people who want to get a more voluptuous backside, and they're doing it wrong. Can you give us some pointers and some tips on making sure we don't do a procedure or any procedure like this the wrong way?
Okay.
What do you recommend? What should we look for? Who should we call? That sort of thing.
Okay, it's definitely important to be working with someone that has got experience with the procedure, experience with the product. This is still something that we really want it to be a really clean procedure, meaning, the patient has been sterilized, marked. We're using a clean field for the procedure. So it's one of those things you just really want to make sure that you're minimizing your risk, because at the end of the day, this is an elective treatment, so we don't want complications. We want to minimize complications at all times. And more than anything, the big thing with this is making sure that you get a really good consultation. And I really feel like 3D photography is really important with this procedure, so you can track the progress, because with this, the result is going to change with time and improve over time. So we really want to be able to track that progress. And that's where the 3D photography comes in, so that I can really see how the shape of the buttock, what the measurements, what the silhouette is looking like.
Right.
So that we can make sure that we're on the right track.
Do you select how much of the Sculptra you use, or does the client?
It's going to be me that's going to be dictating it for the most part. There might be budgetary concerns, but for the most part, we want to make sure that at the end of the day, we get the best outcome. We want the best result. So as much as budget might be of an issue for patients, at the end of the day, I will usually, tell patients what I think is going to get the best result, and we go from there.
And a non-surgical approach is so enticing to people who don't want the downtime, who can't afford maybe a very expensive surgery. And you were saying it's also probably a better option because there can be mistakes with surgical procedures.
Yeah, with the surgical procedures on the buttocks specifically, the biggest complication is infection. For example, with an implant, a glute implant has about a 50% infection rate. And fat transfer to the buttock has very high complication rates too. So that's a flip of a coin. So a lot of patients, although that might be what they want to do, to minimize risk, this is definitely less risky from that standpoint.
And the cool thing is a lot of those procedures require fat to be transferred, but this doesn't require a fat transfer.
It does not. And this patient in particular, if we tried to do a fat transfer, it would be pretty difficult, because to do a fat transfer to the buttock properly requires a significant amount of fat to do it well. And I'll tell you, the majority of patients that want to do fat transfer to the buttock just don't have enough fat to do a good job of it.
And that consultation is critical. And you here at Contour Medical, you guys have that 3D imaging, but not everybody does.
No, it's a newer technology, and I feel really confident that that's one of the trends that is really going to catch on. Is really upping the ante as far as the kinds of technology we use to educate patients, track their progress, and make sure that we're doing really fabulous work. I can say with confidence that the 3D has not only helped patients, but it's helped me, meaning I think I do better work because I can look at the 3D and have it guide me.
So you're only injecting in those areas where you marked?
Correct.
Okay, and you did those marks with her standing.
Correct. Yeah, you don't want to mark the patient with them sitting or laying because you're not going to be able to see.
So we had a question from a viewer who said she's got a wedding coming up and she would like to possibly get this treatment. How far out should she go before her big day?
Ideally, it would be great to do it about 6 months before, but you could definitely do it sooner than with less time if needed. But I think really to get the full result, yeah, 6 months is going to be ideal.
All right, and then tonight, what will she experience? Does she need ice? Will she have any?
Honestly, she might need a little cold pack, but for the most part, it's just a little sore. It's not a big deal. We're going to do a special massage protocol afterwards. We use the Z-Wave doing the acoustic massage. We'll be some homeopathic remedies for reducing bruising and swelling. So it's one of those things we're going to do as much as we can do to minimize discomfort post-treatment. But for the most part, patients are pretty comfortable afterwards. It's just a little sore.
I have a feeling this is going to take off. I mean, everybody is all into the booty right now. We're talking so much about booty.
And I don't see that going away.
I don't either. I think it's the new trend. I think having a nice, curvaceous bum is what we're going to have, and I think we all want it. So are you finished now?
Almost done.
Almost done. We only have about a couple more syringes to go, and then this procedure will be finished. And I want to show you those before and afters again, but they keep switching on us. But we're at Contour Medical. Thank you so much, Dr. McCoy. I know you're going to be super happy in a few weeks and a few months for sure. Let's give you a phone number now. If you are ready to book your appointment for C-Sculpt, give Contour Medical a call. They are located in Gilbert, and you can call them at 480-545-2832 or visit their website, contourmedical.com.